Hey there, Anjali, Queen Bee, checking in from 95.7 The Beach, Tampa Bay's #1 for hip-hop, R&B, and throwbacks. And today I'm with Miss Doris Nardelli from the Central Florida Behavioral Health Network. Thank you so much for being here.
And thank you so much for having me here and for everything you do in the community. I'm so appreciative. The entertainment that you provide, as well as all the great information to help people live healthy lives, is just phenomenal. So I appreciate everything you do.
Oh, thank you. And that's what we're here today for, is to help people live healthy lives. First of all, tell me, how did the Central Florida Behavioral Network start?
Okay, we were founded in 1997 by a group of substance abuse agency heads in Hillsborough County, and they were looking forward and saying, we've got to do something about how do we serve our local communities and be focused on the local needs right where we're at. So they created a Central Florida Behavioral Health Network, and that's when we were formed, and we started receiving federal and state contracts to do behavioral health services, and started out with substance abuse services. And then in 2010, we received the larger contract from the Department of Children and Families with the mental health services. So we provide behavioral health safety net services in 14 counties, from Pasco to the north, all the way down into the greater Tampa Bay area, down to Henry Glades, and over into Polk Highlands and Hardee counties.
Yes. Now tell me, is there still an opioid crisis here in Florida?
Yes, there is, and the federal government recognizes that, as well as the state government. We have made inroads because the federal government and the state has provided, to date, we are close to around, in the state of Florida, approaching $1 billion in monies that have come to stem the tide from opioids, because people are still dying, people are still addicted, people still need services, and we need to have prevention for our young people not to move in to using the opioids, whether in a prescription form or a non-prescription form.
How did it get like this? How did it get so bad so quickly?
Well, what happened, there was a class of drugs that came on the market and was marketed to doctors as an alternative to other existing pain medications, and they were marketed as very safe and very effective to alleviating pain. And so doctors started prescribing them, and people started using them. Dentists, doctors, when you were going in, maybe after a car accident, and you had surgery or you had back pain, and they started really prescribing these, and Florida became one of the places called a pill mill, where even people from outside of Florida would come down here, get a quick prescription, get it filled, go back home. And found out, though, after a little bit of time, and this really probably started about 10 or 12 years ago, that these medications were not quite as safe as they were originally thought. They could become very addictive very quickly, sometimes at the first use, but usually within 5 to 7 days, people could become very dependent on them, and very difficult to quit taking them.
So if this is something that you're experiencing, you're not alone. You think if you're getting prescribed medications from your doctor or your dentist, that it's okay, it's a prescription. However,
when we found out that this was becoming a severe problem, Florida stepped in, the Attorney General at the time stepped in and started closing down the pill mills, if you will, and started looking at a prescription database, so we knew how many pills doctors were prescribing, and then they had to go check, because sometimes if a person had become addicted, they would go doctor shopping. And pill mill shopping
to find a doctor
multiple prescriptions, and they would overtake more of the prescription than they should, and not tapering off, but taking more because they had become addicted. And then that also became a street drug and passed out for people looking for substances for whatever reason outside of a prescription situation. And so it became a street drug, and that is what we're also trying to combat with law enforcement and how it's handled and getting people into treatment. So it sort of peaked in about 2015. It has inched up a little bit, But now it's with everything that has been applied and all of the monies put out there for treatment and the outreach and the collaboration between all of the partners, we're seeing those deaths decline and we're seeing the use decline.
Yes, which kind of brings me into my next question. The Central Florida Behavioral Health Network, of course, wants to provide treatment. But Ms. Doris, many people are skeptical these days.
Mm-hmm.
Do these treatment programs really work?
Yes, they do. Now, there are a combination of several things that the treatment programs do. They assess the person and really understand where they're at in life and what their needs are. And there may be more needs besides I just became addicted to a medication that now I can't manage. There are treatment protocols that they can provide for you that you don't have withdrawal symptoms and that you can take the medication. It seems like an oxymoron to say, I'm going to take a medication so I can become not addicted to a medication. But it truly is a medication that has worked very well to keep people from having the withdrawal symptoms as they're working through whatever it is in their life that maybe led them to being involved with that substance. Could be a lot of different reasons. And they have therapy that's offered to them, as well as the medication-assisted therapy, which keeps them from overdosing, usually, on the prescription medications. So they do work.
And how about this kind of moving forward, if you have a situation and you're in a stage of overdosing? I've heard about a medicine that can literally revive a person from an overdose.
Yes, it is.
Okay.
It is called the registered name that it's marketed under is Narcan.
Yes.
And its name is naloxone. And it is a drug that has been purchased. It's in a little kit. And it's been distributed throughout Florida, mostly with emergency medical technicians, as well as police officers, and in emergency rooms. But you can also buy this over the counter at a pharmacy in case you have a loved one that has gone through treatment, but you're not so sure that maybe they might relapse at some point and you might need to revive them. You can actually have that on hand yourself to administer to them, and it's an inhalant.
Okay.
You inhale it through your nose, your nostrils, and it immediately counteracts the drug that has made you overdose and go into shock to where you are not breathing and you are no longer quote unquote alive. Right. And you will instantly come back. There has been situations where people have overdosed multiple times on the same day.
Oh.
EMTs have been called out and they have administered this drug multiple times to that person. And of course they're trying to get them to a treatment center.
Absolutely.
And get them connected. But it definitely, Florida has gotten on board with this and has distributed, I believe, over 40,000 of these kits statewide. I'd have to check that number, but I think that's the last one I heard.
Okay. Now, I understand that the Central Florida Behavioral Health Network is a managing entity. Mm-hmm. What exactly is a managing entity?
Well, a managing entity, there's 7 of them in Florida, and they were created in 2010 by the Florida legislature. It said, we want to not control this through a state agency. We want to contract these services out and get them closer to the communities. So we were formed, as I said, in 97, and then we assumed this, the managing entity, full spectrum of services in 2010, which included mental health.
Yes.
And we are a 501c3, which means we're a nonprofit, and we operate on less than 5% administrative fee, which is great for the Florida taxpayers because it's not costing you a whole lot of money for all the services we do. And we manage about $218 million in 14 counties for the public safety net. And this is public safety net services that people can access when you have no other, you don't have insurance, you don't have any other source of income, and you really need to have help. You can access our services, and it's a full range of services, and certainly we will. I know we'll tell you to go to our website.
Yes.
But it's www.cfbhn.org.
That's right.
Yeah.
The Central Florida Behavioral Health Network is definitely here to help. But what are some of the barriers from people seeking help?
Well, people think, I don't have any money, I don't have insurance. How am I going to get help? They don't realize that the state of Florida sets aside funds, and the federal government provides Florida with funds to provide these services, and they're available Then people have, there's this whole question of stigma. And stigma is a word that means I don't really want to talk about that I have a problem. And I'm strong enough to handle it myself. Or our family just doesn't do that. We handle it within ourselves. But
If you are shaking your head right now, pay attention. You're not alone. There is money out there for you. And there are other people that have experienced this, have gone through this.
Correct. And we have within most of the organizations that service our 14 counties, we have something called peer recovery specialists. These are people that were where you were at one time. They had an addiction. They overcame their addiction. They are in recovery, and they have decided that their life's work now is to help people where they used to be, because they're so happy with their health and their recovery. They want to give back. They go through specialized training. They get certified in Florida to do this, and they get hired by the organizations that we fund, and they are right there to be your partner to help you, because they know.
Yes.
They know what you're going to face. They know all the objections. They know all of what you're going to tell yourself and your family and everyone else, and they can help you get in touch with yourself and really embrace the road to recovery,
Yes.
to getting better.
And that's what we want you to do. Embrace the road to recovery. You are not alone. There are people that have gone through this, and now there are people that have dedicated their life to giving back. There is financial assistance for you, and you don't be embarrassed, even if you're one of those that comes from a family that our family doesn't do this. Just log on, CFBHN.org. The Central Florida Behavioral Health Network is here to help. Ms. Doris, thank you so much.
Thank you.